Can you tell us a little bit about Gunnar 1 and what were the methods you used and the results?
Okay, sure. First of all, we had a symptom survey that had been refined for many years at what is now the Vision Performance Institute at Pacific University. And this was a survey that involved different things that Dr. Sheehy's lab group had found to be relevant to computer ergonomics. And so there were things we would classify for the subjective part of the study. We would classify symptoms both before, during, and after use of the Gunnar optics lenses as either external symptoms, things that happen on the surface of the eye, or internal symptoms, things that happen deeper in the orbit or feel like they're within the eye themselves. That would include the extraocular musculature and the ciliary body and that sort of thing. And so we would look to see how people were at baseline, how people were in the midst of using these Gunnar optics yellow lenses, and also how they were after they had used them for a period of time. And they're required to use them on the computer at least an hour a day. All of our participants had 4 to 8 hours a day of computer use recorded as something that was standard for them. And so that was what we did for the subjective symptom surveys, and we did these surveys digitally for the first time, where we were digital surveys are nothing new, but when you're running statistics and doing surveys every 10 minutes when you come in for a session in the research lab, that was something we had always done on an analog scale before. So weighing out the Grand Seiko versus dynamic retinoscopy, I prefer the qualitative aspect of dynamic red, MEM and that sort of thing. But the limitation was the Grand Seiko was not only less technique dependent, and so we could use our research assistants, many of whom are optometry students, to obtain the data without worrying about inter-observer variability. But we could also gather data at a rate of up to 5 times a second. The accommodative status, whether it was lagging or leading, can all be calculated from the Grand Seiko. Also, the pupil size is calculated down to 1/10 of a millimeter, and that can be very useful. You never know exactly what for, but when you're trying tinted glasses on someone, particularly a yellow tint, which has been shown in Academy Journal and elsewhere to be the one color of tint that doesn't necessarily cause the pupils to dilate, then it's very useful to see if that's perhaps the effect that these Gunnar Optics digital performance eyewear glasses have on the research participants.
So, what were the results of your study? What did you find?
Well, what we did find is there weren't significant differences between either the external symptoms on the surface of the eye, particularly dry eye and blinking and such, as from the patient's point of view or the participant's point of view. We also didn't find statistically significant internal symptom differences involving the eye muscles, either the ciliary body or the extraocular muscles. And the other symptoms we looked at, including back and neck pain, the ergonomic type of symptoms, also didn't turn out to be significant. But there was a preference for these Gunnar optic tints. About 60% of the participants did say they preferred to work with them on, at least for the hour a day we required. When we looked at accommodation, we also, with the original Gunnar design was a plus 50 lens with a certain base curve. They've now reduced that to a plus 0.20 diopters, 1/5 of a diopter. And we did not find with the plus 50 original design that it was causing a significant difference in statistically so, in accommodative lags, leads, or steadiness of accommodation, if you will. There were fluctuations in both groups. And I should mention, we had placebo glasses as well that had the same Gunnar frame, the same anti-reflective coating, but had a plano non-tinted lens. So we changed 2 variables. We had a no tint, clear lens, and no power in that lens in the original study.
And do you think that possibly there would have been a difference if you had looked at a plano lens with a tint versus a non-tinted plus 50 lens?
Yeah, we weren't convinced that was the case, but of course we can't say for certain from the first study if it was, because we changed 2 variables. However, that is a reason we completed a second Gunnar study, which I hope to be publishing with Optometry and Visual Performance in 2014, that involved, instead of simply looking at the symptoms and looking at accommodation, we looked at dry eye in a quantitative way using a phenol red zone quick test for dry eye. And also we looked at, we have a way of quantifying squint using electromyography. We have a system where we can apply a surface non-skin penetrating electrode to the lower lid thereby measuring the tonus of the orbicularis muscle and counting blinks. And that's a very useful thing that we've done in many studies to see if someone is squinting or is otherwise uncomfortable, perhaps due to dry eye. So those, you'll have to stay tuned for those results, but they're in peer review right now.